in tone, we put sort of UK GPs at the heart of what we do. We've sort of traditionally had a fairly aggressive, newsy kind of outlook on things. We sort of, as you mentioned as well, we try and pride ourselves in the investigations and sort of getting stories picked up in the nationals and so on.
The kind of stories we look for, something really with a definite GP angle, something that GPs direct kind of impact on GPs. Anything that helps them treat their patients better or helps them save time or save money because they're a small businessman, kind of all that kind of stuff is stuff that we would like to cover.
Is there a combination of a dream story that you would love an exclusive on that some of our audience might be able to help you with?
Anything that saves GPs thousands of pounds probably would be a dream story, yeah.
Well, this is quite a challenge because there are not a lot of celebrities tripping over themselves to be in a nursing magazine, and I don't understand that. But we look at people in the media that are coming out and speaking about certain health issues, and we approach them. We also look at charities and who's on their boards and who are their ambassadors, and approach them that way. So that's how we've got hold of things. And we aim to educate and inform and support the work of practice and community nurses. That's all nurses that don't work in hospitals, essentially. Through our events, magazine, apps, social media, community and brands, we want to support them in the job they do. But for nursing in practice, we use Facebook and Twitter, and we have looked at LinkedIn, but we find that we get the most response through Facebook with nurses. So we have 21,000 followers, likes on Facebook, and about 1,700 on Twitter, so not so many on Twitter. So Facebook is our first port of call for communicating with nurses through social media.
So we've been a magazine for GPs since 1960. For most of that time we've been a weekly newspaper format thing, essentially. And towards the end of 2012 we did some audience research, and kind of off the back of that, and also sort of the way things are going in terms of shifting more content online first, we kind of made a couple of changes. So most of what we do is actually put into online effort in terms of our new iPad app, which you mentioned briefly, the emails that you mentioned, and sort of all the readers on our website.